What's up, guys? John here, Titan Talk Tuesday. And you know it's always a good day on Tuesdays because of Titan Talk. And it's also the end of the day. So we now have Wednesday, which is hump day, coming at us tomorrow. So we're almost halfway through the week. That's also a bonus. What's up to everybody joining in out there? Jack's Boy, Kelly, Vincent Mathen, Laura Miller. What's going on? Paul Smith Jr., who else we got here? Ange Tusa, what's going on? M. Matos, D-Roy, Millie, and Fit, what's up? Bernadette, how you doing? Gambino Nicholas, what's up? Bernadette, I've seen your work. You've been doing some good stuff out there. I see you stretching and do all these other things. We have to get you out some Titan gear for sure. Real Lucky Harmon, what's up? Ab Cullum, what's going on? Pop Vamp 13. Thank you guys for all joining in so far. We got more people joining in. I appreciate all the support week in and week out. So I'm here for you guys to talk about some of these different things. Lenroy Thomas, listen, man, I'm going to get with you. Either you can come in here, I'll call you on the phone. I'll make sure I take care of you. So Lenroy is professional boxer. He's doing great things. I've known this guy for a long time. I've just been so busy. I've been in and out of the office. I didn't get to see him last time he was in here, and I always get to see him. So I felt bad. I'll make sure I call you as soon as I'm done with this, Lenroy, for sure, 100%. All right, so every week, I talk to you guys about some of the different things that are going on medically, mostly. And today, we're going to talk about some other things, like our therapy of the week. So a lot of people deal with injuries, whether acute injuries or chronic injuries, right? That means that's something that happened right now and you hurt yourself, or something that's been going on for a while. And people don't really know how to get over some of these injuries, or, you know, day to day they're re-injuring themselves, or it's a nagging injury and it's really bothering their day-to-day life, right? And, you know, they look at different things what to do. And if they keep having these pains and it really does affect their life, you know, at that point, they usually go to a doctor and usually find out hopefully what the problem is, because the doctor usually sends them in for like an x-ray, an MRI, a CT scan. And at that point, you know, the person that's there, the radiologist, is looking at it. He looks at it, he interprets it, okay, and he sends that note over to your doctor, and then he tells the doctor kind of what he sees on the interpretation of whatever the test was. When that happens, okay, then the doctor interprets himself too as well and talks to you about what the result was. And if it's different things like shoulder injuries, knee injuries, right, joints, tendons, ligaments, right, even after surgeries, you know, at that point, you want to heal the fastest you possibly can, because you want to get back on your feet. You want to get going again and make sure you're good to go, whether you're trying to get back to your regular daily life or activities or trying to hit the gym again. And you want to be able to get back there at 100%. So when they interpret these different things, they can tell you some different things to do, whether it's physical rehabilitation or they want to do surgery on you. Now, sometimes you want to, most of the time, you want to avoid surgeries, okay? Because going underneath anesthesia is one risk right there. A lot of people do come out of it. I've had plenty of surgeries and came out of anesthesia just fine. But some people do pass away underneath anesthesia, okay? The next thing after that is that surgery is usually going to have downtime. And depending on what the surgery is, it's going to be a longer downtime. So for me, just for an example, I have a slap tear in the right shoulder. It's a superior labrum anterior and posterior tear. At that point, they told me, hey, listen, you're going to need surgery here soon, and you're going to probably be down for about 6 to 8 weeks. Me, that is a no-go. First of all, I can't be down a day. If I'm even down a day, I'm like 10 days behind at that point. Also, I don't want to lose, you know, the body I've been working for all this time, because at that point, you're not going to be able to do exercising, and, you know, the muscle can, you know, start going through atrophy to a certain extent, or, you know, you feel like you're shrinking if you don't work out for a week, right? So, you know, you don't want to go through these different things. So people look for different alternatives to try to get them by or get them healed, okay? And BPC 157 is definitely a good therapy to maybe help you heal and maybe be a great substitute before trying to do surgery. Okay, and there's other things you could possibly try too, like PRP or stem cells too as well, but those are really, really more expensive. Where BPC, and let's talk about what it is. Body Protection Compound, BPC. And this is isolated from your gastric juices in your stomach, so it's very natural to the body too as well. Now, there's different forms of BPC you can get. You can get injectable, you can get oral. Now, with BPC, it's not, it doesn't work systemically through the body, right? So, if you inject it in your stomach, it's not really going to work in your shoulder area. So with this, if you're going to do it, you should probably do injections. And the reason you do injections is because it's a higher absorbency, faster transportation rate, and you can get it right closest to the injury or wherever your injury is. Now, if you take it orally, that could possibly be good for a couple things. Now, with BPC, body protection compound, because it's isolated from the gastric juices in the body, it's great for stomach issues. So, ulcers, IBS, Crohn's, all these different things. These are actually really good for the stomach to help you in these different situations of health problems you may have. That's where maybe an oral could possibly work because it's going straight into the stomach and straight into those areas. With the injection, like I said, in most of the different areas, whether you just had surgery, okay? And I have a lot of patients have had shoulder surgeries, knee injuries, tears in their hamstrings, pecs torn, their pec muscles torn off their pec, and want to heal faster without surgery. Now, I've had some people that went through surgery, okay? And at that point, used body protection compound 157 and healed a lot faster. Dwayne Dave's one guy I'm thinking of right away, and he'll probably join us on here. What's going on, Hulk Squad? How you doing out there? Coffee 2X, what's going on? Narcine Rio Capali, sorry. Lobus Wally, Big Boy 17, Joseph Posada, Scotty, what is up, dude? My man Scott's on here. Maddox, Lori, how you doing? My man Hulk Squad, and he knows. So Hulk Squad's torn his hamstring, right? And he posted up for us, and he showed us the photos of it, and he used BPC 157, and he healed really quick. Especially for that bad of a tear. And I'm talking about his whole leg pretty much was purple. It was really, really bad. So I'm very glad that it helped him. And I've got a lot of people like this that have had a lot of different injuries. So another one. Golf elbow and tennis elbow. These are very, very common things that can nag you day to day. Now, golf elbow is right here. So it's on the tip of your elbow, and you'll feel it when you bend, or even when you do pull downs or tricep, pull downs. That can be a hurdle. Even if you're driving your car and you have to put your elbow somewhere, right? And you usually put it right in the middle, okay? And you're putting it on there, you're like, oh man, like this really, really hurts. And like you can't even drive with it on the center console because it hurts that bad. I've had this, I know. All right, the next one is tennis elbow. And that's like right here, okay? If you guys can't see it, it's right here. So tennis elbow, when you're doing a back with tennis, that's what it is. So at that point, this could be, this could also hurt when you're doing when you're doing bicep curls, when you're doing tricep pull downs. A lot of different motions can aggravate both of these different areas. And usually, with golf elbow, it's one thing, but tennis elbow, it's usually from your grip, okay? Whether you're doing reverse curls, that could definitely irritate or aggravate that area, and it's just not strong enough. So work on your grip. That's one thing. If you use wraps, you'll hardly ever get it. But if you do get it, okay, this is where you can inject BPC 157 or TB 500 too as well. They work both together really, really great, but we're talking about BPC right now. And you can inject it in this area, and you can inject it closest to your elbow, and it'll work in both areas. You can also do shoulder injuries. A lot of people have shoulder injuries, like myself, and you can just have shoulder injuries from wear and tear. Slaps happen to people that are older because of the different wear and tear they've had through their bodies through the years. So at that point, that's really where it's at, I mean, for me, I got to use BPC 157 years ago when it first came out from the U.S. licensed pharmacies. So you're not getting anything from a research site, not for human use. I see all these different companies online, and guys, they're getting their stuff from China or somewhere else. They're not getting it tested. They're not getting these pure products. And a lot of people are injecting these things, and they're not even worried about it. But they're worried about what's in their pre-workout or what's in their drink that they're drinking. But they're not worried about this stuff that has no testing behind it. So just be wary of that stuff, guys, all right? All right, Tank1228, what's going on? Lemroy, your package should arrive Friday. If you need anything else, you let me know. I'm going to talk to you after this. Mr. Dillon, what's going on? Hampton Thoughts, how you guys doing out there? All right, Tommy Vogue, how you doing? Real Lucky Harmon? All right, who else is on here? Let's talk about, all right. Please hit hit the like button. Please hit share. Jacqueline, how you doing? Boreed 70, what's going on? Dick Torana, what's going on? All right, I'm definitely here for you guys whenever you guys need me. Is this strictly an injectable? Joseph Posada. So no, you can get it in oral form. But like I said, it doesn't work systemically. So usually if you're going to take it as an oral form, it might work, but it's probably not going to work as good as an injectable. And with the injectable, it's a little insulin syringe, so it's not going to be very painful to do this. And some people still have phobias of needles at that point, and I still understand that. But I'm telling you, the juice is worth the squeeze on this one for sure, guys. Okay. All right, Mendez Lucy, what's going on? How you guys doing? Zuma, Rod, what's up, Rodzilla? All right, Green Mark, what's going on? Mr. Cinco, Migos, Isa, what's up? Raw Junior 02. So, body protection compound BPC 157 is a peptide, and this peptide is used. Basically, the way that it works is it triggers a vascular response in your body, right? And basically, it shoots blood and creates these different new blood vessels to help heal the area. So let's give an example of how it really helps and what maybe you can look at that maybe not help. Okay, so let's talk about tennis elbow. So with tennis elbow, usually you get a brace that goes over this area because you're trying to keep everything nice and tight in there. What that does too is restricts blood. So at that point, it's going to be longer to heal or hard to heal that area. Now, when you're bringing more blood to the area, it's going to be easier to heal the area. And that's what BPC 157 does. It's also great for inflammation too. So, for me or other people out there, they have arthritis, right? And rheumatoid arthritis, which is another big one. And when they inject this BPC 157, this will actually take inflammation down and they'll actually get some great relief from it. I always get one off the first shot, right? So this is just another way that BPC 157 can really help you guys. I'm a firm believer in BPC 157 body protection compound. Now, it's going to be good for a lot of different things. It promotes, cell survival, ligament and tendon healing, like I said, enhanced pain management. And like I said, the anti-inflammatory properties are a big thing out there because inflammation is a bad thing on your body. You don't want inflammation, okay? And oxidative stress, too, goes right along with that. And this can be damaging to the body and damaging to your health. So these are just some of the different things that BPC 157 can help you out with. So I'm here for you guys. If you guys have questions on any of these different things, what's up, Big Irishman, my man? WM24SS4 said, great company, great products, and management that cares. This is true. So we definitely care about our patients, and our patients' results are really what we're looking for, right? In the healthiest way possible. We want to make sure, one, priority, your health. You got to be healthy, right? Two, how can we get you the best results, or how can we get you healed fastest, or make you perform your very best? And that's really what Titan Medical Center does. Now, we can service all you guys, right, except for Ohio and Idaho. Everywhere else in the United States, you guys can take advantage of BPC 157 or any of our other services or therapies that we offer here. And it's a wide range, anyway from hormone replacement therapy for males and females, medical weight loss, and there's a whole bunch of different options for that, right? Libido enhancers or bedroom enhancers for males and females, and you don't just need these things. It's not for just erectile dysfunction or just sexual dysfunction. It's for having a good time in the bedroom. And who doesn't like that? Okay? And your partner will like that too. You want to bring some fire, ignite that spark again. The same old thing, day in and day out, or week in and week out. It kind of gets boring, right? You want to just bring that fury, bring that fire one good time. Stacy Mesita, I love you. It's great to see you. Jessica, my girl, what's going on? All right, so with these different things, blood testing, that's another thing. And this is nationwide service, guys. So wherever you're at, we can help you guys out. Even our injectable vitamin amino acid blends. These are game changers and all natural to the body, so they can help without any hormones or anything like that. We have a lot of different blends that get a lot of different results, or will get you a lot of different results or effects. So at that point, you'll be good to go. I guarantee you're going to like some of the different things that we have and have to offer. Also, don't forget peptides like we're talking about right now. We're talking about healing peptides. We have weight loss peptides. We also have sexual enhancing peptides like PT141, which is FDA approved for female libido enhancement, but works on males too. Both in the same way with the nervous system. Right through the brain, baby. Gotta love that. Controls the whole body. And usually guys, the only thing that we had before in our repertoire basically is sildenafil or tadalafil. So this was Viagra, Cialis, and that works on the vascular system again, so blood flow. Where this PT141 works on the nervous system. And we also have some different blends that combine these things too. So there's a lot of different options for you guys out there. And I want to make sure you guys know, because we're not just hormones or we're not just BPC. We're all these different things and all these different therapies. And we keep adding more and more on. It's all about staying cutting edge. No cookie cutter crap. Personalized regimens for our patients from our medical providers. Not from some HRT consultant or somebody answering the phone. No, from medical providers. There's actually people looking at your charts. They're here on site all day, every day, and at that point, we want to make sure we're above board in everything we're doing and we're providing the best patient care possible. All right. So the next thing, Hawk Squad got his DSIP today. All right. So Delta Sleep Inducing Peptide, right? So at that point, I want to know, Hawk Squad, because he's having some issues with sleeping, and a lot of people have to rely on these different narcotics to go to sleep, like Ambien. There's a lot of patients out there that want to take Ambien because they need to go to sleep. And if they don't take it, they don't get to go to sleep. And once they start taking it over and over and over, they need it to go to sleep. And that's not good either. You don't want to depend on anything. You want something that can definitely help, but not depend on it, Jay Lucas, BPC 157, big flex up there. I love it. I'm interested in female peptides. Ellen, okay, so female peptides. Now, all these different peptides we're talking about both work on males and females the exact same way, right? So if you're trying to heal, BPC 157, TB 500, okay? If you're trying to look for anti-aging, longevity, and stuff like that, CJC with Emperellin works with females and males the exact same way, okay? And it will be a great one too as well. Now, if you're looking for female libido enhancement, PT 141. It's specifically FDA approved for female libido enhancement. Now, it works on guys too the exact same way, but it's designed for you females too as well. So if you're looking for some of these things in these different departments, this can definitely help. Plus, we have tons of medical weight loss options, hormone replacement therapy, or if you want to check your blood work to see where all your things are at, because you want to make sure you're optimized too, living your best life, your best quality of life every day, day in and day out. All right, so what else we got here? So, Hawk Squad, I want to know about that for sure, all right? Mikey loves cake. I love cake too, Mikey. Where's my cake at? All right, Freezer, what's going on? All right, Big Boss, John, what's up? Man behind the camera, Art, what's going on? Cigar Craze, what's up? Royalty Reps 95. Sorry, Ohio and Idaho, I'm sorry. The Jack Cookie Monster, what's up, bro? I hope everything's working out for you. Please, if you've got questions, shoot them over to me, man. I love answering them and helping you guys out. Shaq R25, what's going on? Nicole Dea, what's up? Meyer Mike and Rob. All right, Hercules Potion, highly recommended. Big Irishman said that. I definitely recommend Hercules Potion to everybody, males and females alike. All right, so Jessica said, I'm feeling amazing since I've been on Titan Complete and glutathione. So those are great. They're great for day-to-day, great for mood enhancement, boost the immune system, energy, nervous system, hair, skin, nails, all in the combination of those two. So good combination. And I'm glad you're feeling good. Yeah, Ambien is definitely horrible if you have to take it over and over and over, right? Myra Mike. All right, John, thanks for the BPC 157. I have a small tear in my shoulder, and it helps me every time. Mayor Mike. So that's another one. BPC 157, small tear in the shoulder, helps him every time. Me too. So that's why, listen, guys, I'm not going to sit here and talk about a therapy, or we won't even have a therapy here we offer at Titan Medical Center unless it really works. We can't guarantee it because legally we can't guarantee it, and everybody's different. But, for me, I'm always patient zero. I am the rat. So they try the stuff on me. The medical providers are like, listen, this all looks great on paper, all looks good on these trials, but at that point, I'm like, listen, test it on me. I want to be the test subject, because at that point, when I talk about these things, I got to be confident that they're going to work for patients, or at least give my opinion or experience with these medications or therapies. And then at that point, I can back it. Because you know what? There's been a lot of things out there that have came across from these different pharmacies that look good on paper. But man, when I tried it, it was garbage. That's why we've never had some of these different things out there. I can't get behind some of these things if I don't believe in it, or it doesn't work like it's supposed to. That's the other big thing out there, right? All right, so got it. What's going on? Augustine, Coastline K9, what's up, bro? the foos bides, what's going on. I definitely want to know about that for sure. All right. So we've talked about Peptide BPC 157. We've talked about the different therapies and services we offer at Titan Medical Center. And if you guys are interested, it's real simple and easy. Call or text 727-389-3220. Now, BPC 157 does not require any blood work at all. All you have to do is fill out the new patient paperwork. You'll do your medical consultation, and you don't have to be here in Florida. You can do it right over Skype or FaceTime via telemedicine with the medical providers. At that point, you can order your therapies, and we can ship it to anywhere you're at in the United States, except for Idaho and Ohio. I always want to say that because I want people to get upset or fill out the new patient paperwork, and then we tell them afterwards, like, man, I spent 20 or 30 minutes to fill out this new patient paperwork. Why'd you make me do that? I don't want to be like that. I want to make sure that we're very open, honest, and transparent to our patients or people out there. And if you're in one of those different states and you still want to support Titan or be a part of the Titan family, you guys can get a shirt, a t-shirt. Support us like that too. And then if we do open up in those states, I'll make sure we take care of you. All right? All right, so I ran out of Titan Complete a month ago. I noticed developed allergy-type symptoms, which I didn't have before on Titan Complete. I just, what does that say? I just got more today. So it is a good one. I mean, there's a lot of things out there. You know, you can have allergies to different things, and these things really do boost the immune function or boost your body in general, man. So I'm a big believer, and trust me, I've went a couple days here or there through the years and say, you know what? Let me, because I'm very regimented. At that point, I'm telling you guys, when I wake up in the morning, I'm down there taking my injections and doing my regimen and routine like I do every day. But there was like a week where I was like, you know what? Let me see how this is, you know, without, you know, taking my things, my therapies and stuff like that, except for my testosterone replacement. I didn't want to do that because I didn't really want to feel that bad. And at that point, when I did, I was like, oh man, I could definitely tell a difference off these things. And when I take them back, I'm like, boom, I'm like right on. The first injections, I'm ready to go. And I'm like, I know it's not a placebo effect because I took a whole week off and like day in and day out, I was the exact same. So getting back on, I was like, yeah, boom. I was like, I'm ready to go, ready to do this. So it's awesome. Okay. All right. So let's talk about our first subject of the day. All right. And this has to go along with medical, right? Because, you know, we're talking about the first transgender athlete, male to female, to compete in the Olympic Games. All right. So this is pretty serious here. So let's just break down the story. So this guy, Gavin, right, at 20 years old, is breaking all these different records in powerlifting. Okay. In Germany, or not in Germany. I'm trying to think where this guy's at.
He's a Kiwi, which is
Kiwi, right? He's New Zealand. That's what it was. Okay. He's New Zealand. Yeah. He breaks all these records as a teenager. You know, it keeps going on and on. At this point, he says, all right, I'm going to transition. He transitions into a female. At that point, now he's broken all the records as a female, obviously. This guy's not a small guy at all. It wasn't like some small little dude said, I'm going to transition into a female, which I don't care. If you are a transgender or you want to transition to one way or the other, I don't care. I think if a female transitions into a male and goes to male competition, I think it's a little bit more fair. When a guy transitions into a female and then starts, you know, winning all these different things, I'm going to feel some type of way about that because, you know, it's scientifically proven, okay, bone density and height are on the guy's side, okay? So that means we have an advantage over females because of our bone structure and bone density, all right? And so at that point, them going into female sports is unfair. It really is. You know, different people have different views on this. I'm just telling you my opinion on these different things and where I stand. I'm like, listen, if I had a daughter, I wouldn't want my daughter to compete against it. It's unfair, and a lot of females feel like that. And we should make females feel like that. And guys shouldn't be going into female sports. You want to transition to a female, do it. By all means, that's your American right to do that, okay? But it doesn't give you the right to go start competing in professional sports or Olympic sports. This is a little bit crazy. And this is the first time ever in Olympic history. Why? And what their reasoning is because, they tested, their hormones tested at a certain level. Okay? Who cares? I know that, you could really manipulate hormone levels, guys. Females and males. Especially by the time you take your shots and when you stop, okay? That's a whole different aspect of different things. And you can time these things so it doesn't come back and your levels aren't that high. And then it looks like, oh, well, you're within range, you're normal reference range, and no, you're ready to go. And then what happens after that? Do they start taking more testosterone or more anabolics? At that point, who knows? Even at that point, they're already there and have already taken out the female competition, and now they're on their way. So who cares at that point? But it's just really, really crazy, Yeah, he's subject to the same drug test as women. Yes, he's subject to the same drug test as women. And at that point, like I said, you can manipulate your levels, and you can really drop testosterone levels specifically. And if you're taking estrogen because you're trying to be a female, of course your estrogen levels are going to be high too as well, because you're substituting these different hormones in the body. It's not rocket science, guys, and it's not hard to do. It's just crazy, I just can't believe that we're doing this. All right, can I ask a question on how to grow muscle mass? So it looks like Big Irishman did answer this. Lear666, MK677, right? Ibutamoren, Hercules Potion, IGF-1, LR3. Those are just 3 different therapies right off the top of my head that can definitely help in what you're trying to achieve. All right, so Green Mark said, my Zoloft blocks the signal to get aroused. Do libido enhancers work with Zoloft? Yes. So I have a lot of people that are on antidepressants, like Zoloft. And at that point, no worries. We will make you feel like Superman. That's one of our libido enhancers. We have Supermans, we have Ironmans, Cupid's Candy. And yes, we can reconnect that signal so you can get aroused, have the libido, and definitely perform for your partner like you want to. That's one thing that a lot of people, they get looked over, right? There's a lot of people that are, that have depression or have to go on antidepressants. And I feel for those people out there because they have a wide array of different negative side effects. And one particular is libido. The other thing is it lowers testosterone levels in a lot of patients. So at that point, they're getting negative effects and they're just trying to get help. They're trying to feel better and get through their days and feel better about life or themselves. So at that point, they shouldn't have to be punished with the negative side effects of these medications. But that's what it is. A lot of medications have negative side effects, and you might have side effects from that. You have to take another medication to cover that side effect, and so on and so on. I see it through a lot of patients. I know Tsikouris was like that, for a long time, and not antidepressants, but on these different medications, right, that she had to take for IBS and endometriosis and all these different things that she was going through. So, I definitely feel for you, but we can definitely help you out, Green Mark. Don't worry. All right. Next one. First 3D printed residential building is almost finished in Germany. 100 hours of printing, right? It was really, really cool the way I read about this. Now, they've got this 3D printer, and when I think about a 3D printer, I'm thinking about, probably like this big, right? This big, No, this 3D printer is huge. And it printed the whole house, like this concrete and everything that was made for the printer. It would print the house, and the way it was set up is it could reach every aspect of the house it wanted to. And it automatically knew where water pipes were going to go, electricity was going to go, and the people on the ground, the men working on it, could put these different pipes and electricity in while this thing was printing the house. Super cool, guys. 4,000 square foot house living room. So at that point, that's a big house. 4,000 square foot of living space, that's a pretty good house. 2 floors, at that point, so it wasn't just 1 floor. And pretty much top of the line of what it was in the market. So it's really, really cool on some of the technology aspect of what we're getting, especially 3D printers. They're talking about it can make food now, guns, houses, clothes. 3D printers are going to be the future, man. I mean, and how big are these printers even going to get? Are they going to get bigger than this? Because if you look at the article, or if we even have a picture that we can put up there and show you the printer, which was in the article, it's huge, like literally as big as the house almost. But it wasn't, the mass size. But as far as tall wise and going over, I mean, it could go everywhere. And that's just really, really cool stuff. So it goes right along with technology and the whole nine that we're talking about, and advances and things like this. Even medically, 3D printers are starting to produce organs to a certain extent, right? And when we seriously talk about that, we're going to be able to help so many different people and save so many lives out there, which is a good thing. We want to help people and save lives, right? So it's really, really cool stuff. I mean, it's just nuts. THB said, love so much for the Middle East. Big shout out to you, bro. Thank you for tuning in. We got people from all over the world that tune in to our lives and to our podcast. You guys wouldn't believe some of the numbers we have from our podcast. It's ridiculous. And if you guys want to listen to the podcast, and we have a whole bunch of different podcasts with me and Big Drew, Charisse, her old soapboxes. Guys, anywhere podcasts are at, you can go download our podcast or go there and listen to our podcast. Just type in Titan Medical Center or Titan Lifestyle. You'll be able to find them, okay? And for you guys for tuning in, thank you guys again. I really appreciate it. If you guys are on Facebook, press share. If you guys are on Instagram, tag some people in this. Send it to your story, please. I appreciate it. YouTube, hit that subscribe button. Hit the all notification, the bell. Please, guys. And if you guys like what you guys are seeing and you guys are new to this, hit the try dots on Instagram and Facebook and hit all notifications so you get every update of when we go live. So every Tuesday, I'm here for you guys. Let's talk about the weekly poll. All right, so do you have any nagging injuries or problems with joints, muscles, or tendons? That was the poll question. And this is on our poll, our weekly newsletter that goes out every week. If you guys want to subscribe to it, you guys can do it in so many different ways. You can text the number 22828, Titan Medical, right to that number, and you guys can subscribe that way. There's different links on our social medias and stuff like that too as well. All right, so the answers to this. No, 25% said that, all right? Yes, I have some issues, but nothing major. 25% said that. Yes, I take over-the-counter medications for it. 27% said that. Yes, I take non-Titan doctor-prescribed medications. 15%. Yes, I take Titan therapies, BPC, and TB, etc. 7%. So for you people out there that really want to get results and healing, I would implore you to try BPC 157 and TB 500. And if not from us, make sure you guys are getting from a U.S. licensed pharmacy prescribed in your name. I've had so many people come to us and say, oh, I tried BPC 157 for this injury. I'm like, well, where'd you get it from? Oh, I got it from some research, some online site, just sold it to me, I'm like, so you didn't see a medical provider and it didn't come from a U.S. licensed pharmacy with your name on it? No, I just got it in the mail, and at that point it said for non-human use or non-human consumption, research chemical only. But I took it. I'm like, okay. I'm like, well, that probably wasn't good. You're kind of playing Russian roulette with what's in the bottle because you really don't know. And I guarantee you, if you pretty much try BPC 157 from a pharmacy, it's going to work. That person signed up, did BPC 157, and got healed. They're like, man, I'll never do this on these research sites again. So this is just one thing you guys need to be aware of out there. Not all BPC 157 is on the same level, okay? All right, so upcoming events, July 31st, Tampa Bay Jeep Fest here in Clearwater. August 7th, Tampa Pro. We're going to be there in full effect. Tons of giveaways at all these events, especially Tampa Pro. A special giveaway at that one. All right. NPC Deke Warner, Florida State, August 14th. That's the weekend afterwards. We'll be out in Orlando again. September 9th, 11th, St.Pete Art and Fashion Week. Out in St. Pete, Titan Medical Center is the main sponsor, and we'll be having more of our fashions in that. Always a great event by Donna Crowley and Lux Fashion Group. We're happy to be a part of all those events. The next one, October 7th, Olympia in Orlando. We're going to be there in serious full effect this year, guys. So at that point, I want you guys, if you guys are in the area, to come out to Orlando October. Because, man, I'm telling you, Titan's going to put on a hell of a presentation. I'm going to have super giveaways, and we're going to have some special guests out there that are going to blow your mind. So get ready, because Titan Medical Center is going all the way this year. We got 6 months left. We're already halfway through the year. So trust me, I'm raring to go for the rest of this year. I have got some super, super things in the mix right now that hopefully are going to get bigger and bigger, and I'm going to be able to present them to you guys and show it to you guys. So I appreciate all you guys tuning in. Thank you so much for all your comments, interacting. Big shout out to Big Irishman, Hulk Squad, and everybody else that are out there that tuned in. Thank you, but here, Mike, for giving us your testimonial, pretty much, of BPC 157. I appreciate you. Thank you very much, and everybody else out there. Guys, tune in. Next Friday, or this Friday, it's a Titan Lifestyle with me and Big Drew. Sharice is going to be on tomorrow with her Soapbox Live about 1:30, 1 o'clock right in there. So if you want to hear some funny stories or some different things or ask her some questions, you females out there, tune in. All right, guys. I'm John from Titan. It's been another great Titan Talk Tuesday. I'll see you next week, 6 p.m. As always, Titan Talk Tuesday with me, John, CEO, Titan Medical Center. Later, guys.